My name is Alicia Chaves. I'm a pediatric cardiologist at the University of Maryland Children's Heart Program. As a pediatric cardiologist, I take care of kids with congenital or acquired heart disease. That can be a full spectrum, actually, from fetus into young adulthood. My particular specialty is in non-invasive imaging, and what that means is basically that we use a lot of different imaging studies to try and diagnose and help to monitor congenital heart disease and other types of heart disease in children. So we try and make things as painless and as simple as possible. In the past, if we had a child that we suspected a heart defect in, we would have to do a procedure that involved using anesthesia where the patient would go to sleep. We would have to use needles and catheters that would go inside the body and try and diagnose things in that way. Now we can do much more simple procedures like ultrasound or MRI, which, other than having the patient sit still, doesn't really require too much discomfort on their part. And we're able to get very accurate information, and probably even more accurate information in some cases than we were 20 years ago. From images, for example, on an echocardiogram, which is simply an ultrasound of the heart, we take many different pictures, and we're able to, in our minds, reconstruct what the anatomy of the heart is and see things like holes in the heart, valve problems, and various other more complex forms of congenital heart disease. And then with that information, we can put it all together and we can talk to the families about that. And that's one of the things that, especially I think with fetal echocardiograms, which is doing the same kind of thing but on the baby before it's born, we're able to give parents a lot of information about what is going on with their child and what the problem with the heart is. And then we can also give them an idea of what's going to happen. So we can help them to plan, to prepare, and to understand where their child's going to be in 6 months or further down the road. We often get patients referred to us by obstetricians who might notice something on the regular prenatal ultrasound that's abnormal about the heart. And then when we see them, we'll do an ultrasound looking specifically at the baby's heart and trying to figure out what's going on. And I think, for many families, being pregnant is an exciting time, and they're very anxious to see their child and meet them, and then to have something thrown on top of that is a concern about the heart can be very stressful and scary. So we hope to be able to figure out exactly what is going on with the baby's heart, and then to explain that to the parents. Not that they're not going to worry, because we know they're going to worry, because they're parents, and even before the baby's born, they're parents. But we hope that we can at least give them information, and sometimes that helps to get rid of some of the fear and some of the anxiety, and to help them prepare, because giving birth in and of itself is a stressful time, but if the baby is sick on top of that and may need to stay in the hospital, it helps to be able to know, how long, what's going to happen exactly after the baby's born, so that they can prepare not only just the logistical things, but actually just emotionally prepare for what's going to happen. In some cases, with some types of complex heart disease, it's best if babies are born in a place where there are specialists who can care for newborns with problems, so neonatal intensive care units and pediatric cardiologists available to take care of their child. And it can be very helpful to be born in a place where those services are available, if not only for the health of the child, but also for the ease of the family of having mom in one hospital and a baby in another hospital. It just adds to the stress of the situation. And having the baby in the correct place can mean we can start medication sooner, means we can stabilize the baby sooner and figure out what we need to do next. Well, I think that we have a dedicated team of physicians who really care about taking care of families and children. That's probably true at most places, but I think that we really strive to not just do the medical part right, but also do the family care-oriented part right, and to really help educate families and to counsel them and be there for them. We also want to be able to provide a good line of communication between the family and their pediatrician, and be able to talk to them and let them know what's going on with their patients.